So the MSAT is a professional's degree. In other words, they come into that not having been an athletic trainer, and they're gaining all the skills and meeting certain accreditation requirements to sit for a national board exam to become an athletic trainer.
But in addition to that, they'll come out more qualified than any other athletic training professionally qualified student that we have ever seen. It's not something I would say lightly because I wouldn't want people to challenge me on that if that wasn't true, but we can back that up as well.
I really love this program because not only does it challenge you as a clinician, it challenges you as a person. It allows you to take this idea of what we thought athletic training was and just expand it even more. It's not just, at a high school, at a college. There's so many places that you can go as an athletic trainer.
It's very focused on manual therapy, on being a very effective and efficient clinician in a multitude of environments. So whether you're working as a clinician in a hospital practice or a private practice in a clinic, or if you're working in an athletic setting, it's sort of the same idea that there's a large scope of practice for athletic trainers and that you can be very effective and efficient throughout any scope of practice. The most attractive thing for me was being able to be out and actually be working in the environments that I would want to explore working in as a clinician as I further my career. Plus being a researcher, which is really exciting on the master's level to actually reach out into that research community and function in that environment to try to advance the profession and advance the knowledge base.
The research is, just like in the DAT, is based on clinical practice. So they'll develop an idea using probably one of the newer paradigms that they've used or treatment options that they've used, and then they'll treat a bunch of patients and record their outcomes. And it's very similar to what we use in the DAT, except for it's more guided. And a lot of times our doctoral students are participating with our master's students in those projects.
I am so blessed with this program, with these professors. Throughout my education, I've been in much smaller schools, so I've always had that one-on-one relationship with my professors. And the fact that I still have that in a grad program is amazing. At any point when I'm struggling, which I have, they were there for me. And I know they will be there for me even once I'm done with this program.
The innovation is on multiple levels. The curriculum, the networks, the business model, all of these support really what I've considered probably one of the most healthy environments for a professional or post-professional training program that I've ever seen.
We have the best professional preparation in the country. We don't just learn what to do, they actually do it. They don't spend a lot of time following people around, they spend a lot of time treating patients. And they reflect on that, and they're already collecting outcomes before they've ever been credentialed. And so that's really powerful.
It is a challenge, but it's a healthy challenge. It's going to push you to make you better. It's not challenging to you can't do this. It's going to make you better in the end. But there's still that element of fun and interaction with it. You're constantly learning. It's never a dull moment.